Very good evening to all of you. So, after a long gap, we are restarting the Organon classes. So, we have done till Aphorism 209. So, we'll start with Aphorism 210. From this point, the discussion on the mental diseases will start. There is differentiations among the different kind of mental diseases. There are some emotional diseases, there are some mental diseases. So as we go along in the aphorisms, we will try to discuss those differentiations and how we have to go along in those cases, how we have to understand those cases, how we have to tweak some of our points in the case taking so that we can come up with a remedy for such patients so that they can get cured. So we will start with our presentation. So aphorism 210. So we are talking about the one-sided diseases, that diseases which come only on one single part of the body. They show very few symptoms, but when examined carefully, those few symptoms can give us the complete picture of the disease itself. So of psoriatic origin are almost all those diseases that I have above termed one-sided. And all these one-sided diseases, whether they are coming on the local parts, whether they are coming on the part of the mind, they're all of psoriatic origin, which appear to be more difficult to cure in consequence of this one-sidedness, all their other morbid symptoms disappearing as it were before the single great prominent symptom. So again, just to recap, that once in one-sided diseases, we have very few symptoms or no symptoms at all, only just one single prominent symptom or one or two prominent symptoms which are there in front of us, while all the symptoms have disappeared. So Dr. Hahnemann is saying that it is difficult to cure them because they do not have much symptoms. They do not have symptoms which can stand out as very characteristic symptoms. So we have only very few symptoms. We have only some symptoms, but those are prominent ones. We have talked in the last few aphorisms that those symptoms are very prominent ones. And when a remedy is prescribed on those symptoms, it can cure the whole case. So of this character are what are termed mental diseases. Even the mental diseases, they have the same kind of character, that they have one-sidedness to them. They do not, however, constitute a class of disease sharply separated from all others, since in all other so-called corporeal diseases, the condition of the disposition and mind is always altered. There is no disease which we can call is a completely physical disease. If some part of the disease body is getting diseased, the whole is always involved. Even if we are having pain in some part of the disease, the mind, the rest of the body, they are all involved. They're all feeling that pain. So Dr. Hahnemann here is saying that although I am calling this part or these kind of symptoms as mental diseases, but they do not constitute a separate class. Because why he's saying that? Because in all the corporeal, all the physical diseases, the mind and the disposition is always altered. There is no disease. Even Dr. Boeing Hassan states that during the stages of latent sora, the sora is basically how the disease shows itself on the physical body with any kind of symptoms. When it comes on the body, we say that, okay, this is a psoriatic disease or a psychotic disease or a syphilitic disease. So that is when it is shown on the physical body. But in the state of latency, when it is not showing itself on the physical body, the disease is not gone. It is trying to develop at the parts of the mind in different kinds of emotions and different kinds of behaviors. So it is not until and unless some very good treatment is given to a patient, we cannot say that we are healthy or we are basically disease free or any other patient is disease free. Just the absence of symptoms at a particular time, it should not be considered that the patient is healthy. We have to see where it has gone, where are all the symptoms gone. Dr. Boyinghausen, in his lesser writings, there is a one of the chapters where he mentions this thing, that during that stage of latency, a physician should always see that what are the changes coming in the behavior or the mental part of the patient, because it is developing there at that time. So there is no physical disease which comes without the alteration of disposition and mind. So because of that, he's saying that this is not a different class of disease, but yes, we can call it mental disease. Why? Because here the disease is more prominent on the mind. And in all cases of disease, we are called on to cure. The state of patient's disposition is to be particularly noted. And in every case, all the cases where we are uh, called to cure a patient, we always say that disposition is a very characteristic part of the patient. For example, there was a child today who came, a cerebral palsy child. So when I was looking at his symptoms, some symptoms of convulsion, some symptoms, his physical symptoms, nux vomica was coming very prominently. The kind of the constipation, the kind of the sensitivities that child had. So nux vomica was coming very prominently. But he was a very, very smiling child. The parents told that he never gets irritated. He's always smiling, he's always laughing, very easy to be pleased. So that goes completely against the disposition of nux vomica. And that should only be one symptom which should stop us from prescribing this remedy. Because the state of the disposition is a very, very prominent characteristic part of the patient and it should not be ignored. It can never be ignored. So the state of the patient disposition is to be particularly noted along with the totality of the symptoms. So whenever we are called upon to see a patient, when we are taking a case, when we are assessing the medicine, when we are analyzing the medicine of the patient, the disposition of the patient should particularly be noted and it should be among the totality of symptoms which the medicine should cover. If we would trace an accurate picture of the disease, and we have talked about this thing when we have talked about sora, we have talked about this part of the disposition, that how it develops and why it is given so much importance. Why, like I told you just right now, the example that even having very strong symptoms of some remedy, we can basically rule out that remedy, or we can just get it out from our analysis because it does not matches the disposition of the patient, or the patient does not have the disposition of the remedy which we were going to prescribe. So it holds so much importance. So if we would trace an accurate picture of the disease in order to be able therefrom to treat it homeopathically with success. So if we wish to cure the patient, if we want to treat the patient successfully, and in order to trace a right picture of the disease, the disposition has to be included in that accurate picture. Only the picture of the disease will become accurate if we have added the disposition of the patient to that part. So this only thing, this only line, this only these words can tell us that how important it is to understand the disposition of the patient and how important it is to include in our analysis. So there's a footnote to aphorism 210. How often, for instance, do we not meet with a mild soft disposition in patients who have for years been afflicted with the most painful diseases, so that the physician feels constrained to esteem and compassionate the sufferer? So Dr. Hahnemann is giving some example of the patients like who have been very mild and soft, and from a long time they have been affected by some kind of painful disease. And when you see the condition of the patient, we feel sympathetic towards them. We feel that how much they are suffering, and we feel uh, constrained to help those patients. But if he subdue the disease and restore the patient to health, as is frequently done in homeopathic practice, he is often astonished and horrified at the frightful alteration in his disposition. And sometimes, when the patient gets better, when the physician is able to restore the patient, which is frequently done with the homeopathy, he says that sometimes you are very astonished, and this has once happened to me. The same thing which Dr. Hahnemann is writing about with one of the patients who was suffering from a kind of like he was dying. He was in that state of uh, disease, and he came out of it. He went on to become healthy, and you see that how that disposition, because the mind has been changed during that process of disease. Some parts of the mind which the formerly the patient was, that has changed. So you can see that change in the disposition when the physical health is also getting better. He often witnessed the occurrence of ingratitude, cruelty, refined malice, and propensities most disgraceful and disregarding to humanity, which were precisely the qualities possessed by the patient before he grew ill. So before he went into that kind of state, when he went, even many times in acute diseases, you can see these kind of things in acute diseases. Suddenly a patient who has been very mild in a fever, very want like a pulsatile person, once he gets better, he comes to his this older self of being dominating, of being angry, of being abrupt, the who was very soft and sweet during that acute phase. So main thing to understand is that whenever some disease processes start, they basically affect the disposition of the patient. Those who were patient when off well often become obstinate and violent, hasty or even intolerant, and capricious or impatient or desponding when ill. Those formerly chaste and modest often become lascivious and shameless. A clear headed person not infrequently becomes obtuse of intellect, while one ordinarily weak minded becomes more prudent and thoughtful. So, in the mental picture, also, the intelligence gets affected, the disposition, the emotions get affected, the behavior gets affected, the will gets affected whenever the disease process is going on. And a man slow to make up his mind sometimes acquires great presence of mind and quickness of resolve. So both the things uh, can happen in the state of mind. Anything can get affected in the state of mind when the disease is going on. So that is this is an example which Dr. Hahnemann is giving to make us understand that how much it is important to consider the state of the mind and the disposition of the patient when we are prescribing, because they are already and every time affected, even in the physical disease. Even when the physically a patient is becoming weak, or he's getting diseased, or he's having some kind of pain, he's having some kind of chronic disease, the mind and disposition, they are always affected, and they should always be taken in the selection of the remedy. So this holds good to such an extent that the state of the disposition of the patient often chiefly determines the selection of homeopathic remedy. And it is so good to that an extent that it becomes a prominent symptom, the disposition of the state of mind. It becomes a prominent symptom in determining selection of the homeopathic remedy. Like I gave you the example of Naxwamika. That disposition of the boy, it became a like he's so openly affectionate. So you need to think about the remedies which are openly affectionate like that, or at least we will not give the remedy which is completely opposite. That is how the rule out system works, how we have to throw out a remedy from our analysis as being a decidedly characteristic symptom which can least of all remain concealed from the accurately observing physician. And The thing about disposition, the thing about the behavior is that the patient can never withhold that from us. He can never withhold. If a patient is fearful, that fear will be shown. The way he talks, the way he is behaving. If a patient is timid, that will be shown. They will be soft in speaking, they will be low in speaking, the voice will be low, the eye contact will not be there. Okay. So if a patient is impatient, if a patient is, who can suddenly go, that will also be seen. Even if he is trying to control himself or she is trying to control herself, that irritation will come up in some kind of words. So if we are observing in a very, very accurate way, that symptom can never remain concealed. That symptom can never remain in obtuse state. It will always be revealed. It will always be shown. The creator of therapeutic agents, very beautiful word, the creator of therapeutic agents has also had particular regard to this main feature of all diseases, the altered state of the disposition and mind. For there is no powerful medicinal substance in the world which does not very notably alter the state of the disposition and the mind in the healthy individual who tests it, and every medicine does so in a different manner. So he's saying that the creator, when he was making these therapeutic agents, he kept this thing in his mind. He kept this thing in a very particular regard, that all the features of the disease, that there is no therapeutic agent, an agent, anything which can cure a disease or when given to a healthy patient can alter or bring out the symptoms of a disease. He's saying that no, there is no such agent which does not alter the state of disposition of mind. So the creator of these therapeutic agents, he kept this thing in main regard, that whenever the disease is going to come, it is also going to affect mind and disposition. So the therapeutic agent, so the medicine, it should have the power to cure that mind and disposition also along with the physical part. So he's saying that if whenever you will test some therapeutic agent, you will always see that the mind and the disposition, they are always irritated. A very good example is quinine. Quinine is a medicine which have been used a lot, and I think that almost all the doctors, the old doctors or doctors who have given allopathic medicine, or they have recorded in a very detailed manner what has happened to the patients after the quinine. It was a very common thing which came with the quinine, that whenever it was given in large quantities to the patient, there was an intense irritability of mind, which came with the quinine, or a very uh, low state of mind, a dull state of mind, which is produced by the mercury. So even the doctors who did not took or gave medicine with keeping this thing in mind, that I have to prove the medicine or I have to see the effects of medicine, they were just giving the medicine as it was supposed to be given. But they also noted these kind of changes in the mental or the dispositional part of the patients, that after this medicine the patient has become more aggressive, more irritable, or he has lost the chain of thought, the intellect has become low after the medication. Because all the medicinal agents, they have this power to affect the mind and disposition when given in the healthy state, or even in the other states when given in large doses, they have this power to affect the mind and the body. So we shall therefore never be able to cure conformably to nature, that is to say homeopathically, if we do not in every case of disease, even in such as are acute, observe along with the other symptoms those relating to the changes in the state of the mind and disposition. So he's saying that we cannot cure homeopathically any patient, and it is very true. It is very true. I have seen doctors who have been prescribing from years just on the physical symptoms, just on some keynote symptoms, although they are taking it as a characteristic symptom, although they see that it is a something which is unique in the patient, but on a physical part, like for example, if I would have given Naxomica today, what would have happened? It would have ameliorated some symptoms. It would have ameliorated some symptoms which Naxomica would be similar to, or given a partial relief. They might have come afterwards, but the patient will not be cured. And I have seen this thing happening, that when we have given some uh, patient some medicine without considering or without taking into our analysis the mind, and the patients, they don't get better, or they do not cure homeopathically as we believe that they should get cured. The second aphorism, the ideal cure, how it should happen, they don't get cured like that. They don't get better like that. The symptoms, they will come back, or some new symptoms will take place of the old symptom which is gone if it was of less intensity, but the patient remains sick. So even in acute cases, not only chronic cases, but even in acute cases, it is very important to take the change in the state of mind and disposition. How the mind and the disposition of a patient is changing over the course of time. And if we do not select for the patient's relief from among the medicines the disease force, which in addition to the similarity of its other symptoms to those of the disease is also capable of producing a similar state of the disposition and similar state of disposition and mind. I think, just let me check if this it is written in a complete form. 230. Yes, okay. So we will never be able to confirmably cure. We will not be, if we are not selecting a remedy which can basically affect the similar state and the disposition of the mind as it is shown in the patient. We have to select the same remedy, a similar remedy to that state of the mind and disposition, and every word is true, because this thing has happened to me, and I have seen it happening to many of other doctors around me when we have talked, some old doctors also, when I have seen their cases, that whenever this thing was not taken into conformity, into that final analysis, the cure did not came. The cure never came. There was a partial relief. There was some symptoms which have gone, but the patient always remained sick. Because when I started understanding it in a more deeper manner, when I went more deep into that thing, the sora is coming from somewhere of that state. The sora is basically arising from such states. So it is a very direct, we can say, I'm not saying that sora is a mental picture. No, please don't take it in a that way. No. But somewhere when the sora is affecting, it is affecting that disposition part and the mind part also, along with the physical body. It is developing everywhere in the body. So when it is developing everywhere in the body, and many times you have seen in yourself, whenever we are overpowered by some kind of emotional state which we are already having, for example, we are more overpowered with despair, something, the things are not working the way we want them to work, the things are not happening as they are supposed to be, So we start getting more anxious or sometimes more sad. We are feeling that there is more failure than the success. So the body starts feeling more weak. There will be some kind of diseases or symptoms which will start appearing, which will make us more weak. Some kind of pains will start coming up, some kind of muscular pains, or some kind of weakness of the muscles. Some kind of states would start coming up where the body will feel more lethargic, feverish feeling will start coming up. So there is a very close relation with the physical symptoms or the physical disease and the mental disposition, how we are feeling at that time. Suddenly if something good happens, you are in a state of elation, you are very happy, something has worked for you. Even the chronic pains, they subside for some time. Some kind of pain which was there, I always give an example that if there is a very good function going, like for example you are celebrating something, you are celebrating a birthday, you are celebrating an anniversary, you are celebrating some marriage in the house, suddenly the whole family is active. Even those patients, those people who have been suffering chronically from some kind of pain or something, they also start working up, or doing something which in the normal days you cannot think of that person that they can do this thing. So suddenly when we are into that state of excitement, into that state, suddenly the whole body starts working in a very fine way. So there is always this psychosomatic relation there, it is always there. We cannot deny that the mind and the body, they get diseased separately, they are diseased at the same time, they get better at the same time. After the medicine, when the patients they start getting better, if it is a right remedy, if it is a homeopathic remedy, you will see that they start becoming better in every way. Not only their physical symptoms, but the mind shift is there. All those negative emotions, all those negative behavior, they start becoming less intensified, and good emotions or good behaviors. I have seen people who have stopped going for morning walks or exercises from 10 years, 12 years, because they didn't felt like it, because they had some pain in the they start going, they start doing it, they start feeling that kind of energy that yes, I want to do it. The people who were not able to uh, do some mental work because they felt dull, they felt there is no energy in the body, they start reading, they start reading the newspaper, they start enjoying the talks, they start enjoying the discussions. So when the disease is affecting, the whole is getting affected, and when the disease or the patient is getting cured, the whole should get cured. So footnote to aphorism 213. Thus, aconite will seldom or never affect either a rapid or permanent cure in a patient of quiet, calm, equable disposition. So if a patient is of calm disposition, quiet disposition, the aconite will never affect either a rapid or a permanent cure, because the aconite is a very sudden remedy, very uh, angry remedy, very you can say blasting remedy. So if a patient is of quiet nature, very equable nature, very calm, aconite does not is not similar to that disposition. And just as little will nux vomica be serviceable, where disposition is mild and phlegmatic. If a patient is mild, like I told you that today the patient was very mild, extrovert, laughing kind of child, very happy child. Nux vomica will not work in those states, even if it is matching these symptoms. Pulsatilla, where it is happy, gay, and obstinate, because pulsatilla is basically a sad remedy. Pulsatilla is a mild and yielding remedy. So if a patient is very obstinate, very happy patient, you know, he is a very dominating patient, the pulsatilla will not work there. Or ignitia, where it is imperturbable and disposed neither to be frightened nor vexed. And ignitia will not work there where the person does not get frightened easily or does not get angered easily. the ignitia do not work, because ignitia has a disposition, very sensitive, oversensitive disposition, which goes into strong emotional states very quickly. So if a patient is more of a very slow in his emotions, not showing much of his emotions, very controlled in the emotions, ignitia will not work as good there, as it is supposed to be. So the instructions I have to give relative to the cure of mental diseases may be confined to a very few remarks, as they are to be cured in the same way as all other diseases, namely by a remedy which shows by the symptoms it causes in the body and mind of a healthy individual a power of producing a morbid state as similar as possible to the case of disease before us, and in no other way can they be cured. So he's saying that when I'm going to give some remarks on the mental diseases, it will not be very different thing till what we have discussed till now, because they are to be cured in the same way as all the other diseases, because in all the other diseases the mind and the state of the disposition, they are always affected. So there is nothing very different which we have to do. Yes, there will be some points, there will be some things which we need to consider more, or we in the choice of the remedies we have to give importance to certain remedies which can produce these kind of states uniquely, because every medicine, it produces a unique state of mental picture, the dispositional picture. They have their unique states. So we have to understand those unique states from our materia medica also, and we have to understand those unique states in the patients also. Okay. So a power of producing a morbid state of the mental disease as similar as possible to the case of disease before us, and in no other way can they be cured, and there is no other way to cure them. There is no other way, because many times he will give the distinction of those diseases, that sometimes people think that the advice or counseling or some kind of you know if we can talk to some patient who have been suffering from mental disease, it can get them better. We should be very very cautious about that, because in certain mental diseases the counseling or any kind of remark which we are telling the patient, which we are telling them to follow, it can produce a very negative result. So we will be talking in the further aphorisms when we will go through them. So we have to understand that there is no other way. And I have seen patients who have been taking so many kind of medications, so many kind of therapies, so many kind of uh, things they had been doing their whole life in such conditions when they have been suffering from these kind of mental diseases. Some things have helped them for some time, but nothing has, you know no therapy or no other medication have been able to cure the patient. Because whenever we are talking in homeopathy, we are talking about cure means that the patient should go to the healthy state. He should be healthy, he should no longer be diseased. So in order to produce that cure, Dr. Hahnemann is saying out of his experience, because he had also um, done all kind of things during his time, and he was a better person to tell this thing. And even the doctors who have been practicing from past 30 years, 35 years, 40 years, they can easily see when they have seen thousands of patients of that kind, and they can ask about what kind of treatments they have done, they have taken. We can see that nothing has helped them for a long time. Cure is a very distant this thing, but nothing has even helped, like just to make them stable in these kind of cases of bipolar mania, schizophrenia, some deep depressions, some suicidal mania, some panic disorders, anxiety neurosis, or some this disease of the children like autism. So nothing have helped those patients. And in homeopathy we have cure, but we have to we have to understand the way how we have to see the patient and how we can approach that case, what we have to keep in our mind while approaching such cases, because that is what is going to help us to cure such patients. So we have to give very keep a keen mind, keep an open mind when we are approaching such cases. So we will discuss the whole part of that mental diseases in the next class on next Wednesday. Today we have understood the importance of the dispositions, that why they are important, why the mind or the state of the disposition is important in choosing a remedy, not only in the mental diseases or the cases which are arising from such things, but in all the cases, whether it is a physical disease, whether it is an acute disease, because the mind and the state of disposition, they are already every time they are affected, and we need to choose a remedy which is also similar to that state of mind and disposition. So whenever, that is why whenever we are seeing the cases, we give importance to that part. We have a different section in the case taking, that how the patient feels, what are their usual behaviors, how they act in the states of anger or fear, or when they are anxious, how they act in that thing, because that all tells us about the state of the mind of the patient. So keeping that in mind, just go through these aphorisms again, so that, because it is a characteristic symptom in homeopathy. When we are prescribing, we are just searching for the characteristic symptom, and it is the biggest characteristic symptom which is always present and is always in front of us. It is always in front of us. You don't need to go into the study of psychology to understand that thing. You don't need to study something separate. You just need to see the patients with a very keen interest in how they are behaving. Once you start paying attention to how they are behaving, how they are telling the things, how, what are they doing, what are they doing when they are at home, how their their social relations with the other people, and you will start understanding the disposition of the patient. You will start understanding the mental picture of the patient. You don't need to understand it in a very deep manner, but yes, a general picture, how they are, only that can give us an insight that okay, this can be this remedy, and he cannot, she cannot be these remedies. So from there the clarity of the case starts coming. Okay, but that also does not mean that it is the only important symptom. It is an important symptom along with the other important symptoms which belong to the generals of the patient, which belong to the particulars of the patient. So there also we have the characteristic symptoms. But yes, when we are talking about the mental diseases, it will be more in the state of mind. So when we are going to cure, we will talk about it in detail next time. So we have to understand how the patient has been behaving since he has become sick. So just go through these aphorisms once again, and if there is any problem, anything which was not understood, we can discuss it again in the next class. So till then, thank you and good night.